here with John. John is a patient here since about 2013, I believe he started coming in. John came in originally with a few different issues, but primarily was the left shoulder. We've been working on it pretty diligently. It's something that we address every single time John's in. John's particular interests are in CrossFit as far as performance and working out, and now John's level 1 certified in CrossFit as well. Works out and trains at CrossFit Templar. John, you know, it's funny when you get a shoulder issue like that. He had radicular symptoms, so it's like, is that coming from the neck? Is it coming from the shoulder exactly? And we really had to dissect, you know, what does the spine look like, and the correlating muscles over to the shoulder, and really kind of dialing it into the exact problems and fixing it kind of from the inside out, I would say. So maybe John, you can talk about just your experience and first coming in and what brought you in. And
yeah. Well, I first came in here because I was having troubles at the gym. Every time I tried to lift a weight over my head, pain would shoot through my shoulder and my arm. And Dr. James said that it was definitely fixable. It would take a fair amount of time and effort, but I was a little skeptical, but also eager to get this problem fixed. And I remember the specific day where everything turned around. Mm-hmm. I'd been coming in for about 8 weeks, and you were doing an adjustment right on here. Mm-hmm. And I felt something click. And you said, "Hey, did you feel that?" Mm-hmm. That was your tendon finally going back into the right place. Mm-hmm. And at the gym, after that, I saw immediate change. I no longer had any pain. I immediately started going up in weight on all my overhead lifts. Mm-hmm. And since then, I've actually been able to use proper form and technique on all these lifts, and I've been making steady gains ever since. Yeah,
we marked that day, and you know, I even came out and said it. I said, you know, if you go through the process here and do what you're told to do, that we expect personal bests, and that's something that's pretty common with athletes that I treat from the CrossFit arena. I mean, across the board, just because they push themselves to the max on a frequent basis. So it's those little biomechanical advantages that really produce a huge amount of output. And that's the same thing that we saw for John. So as far as chiropractic, let's talk about that specific, and would you recommend it to anybody that you know? And
yeah. And I have, and actually, you know, some of the people from my gym who saw what I was doing and then came in afterward. Yeah, I'm a big believer in chiropractic, and it's. I mean, I'm living proof of how well it's worked. You know, I came in with all these problems, and it's just been solved. And furthermore, not that I, you know, am afraid to, you know, go see doctors and surgery and stuff like that, but I find that chiropractic has a much better success rate, and it's non-invasive and definitely preferable.
Yep. And you know, John eventually, you know, gets results, and then it's kind of how it works. You start seeing all of a sudden spouse and kids and, you know, other family members, and it just grows, and it really makes for that nice wellness community. I mean, within his own family, and it's kind of cool because you're seeing the different performance breakthroughs, and you're just seeing, you know, the kids are healthy, and you know, it becomes really fun. It's really rewarding.
Well, I think Finish Line is great. The staff is very professional and friendly. The facilities are really nice. I've been to a lot of chiropractors over the years, and one of the reasons that I was actually skeptical at the beginning, and I think I told you this, is that normally I would feel some problem, I would go in, get an adjustment, and then leave and maybe not see them for a couple of months or something like that. Whereas you're the first person who actually said, you know, we got systematic problems here, and we have to, you know, work through them, and it's going to take time. And that's why I come here all the time now, and, you know, still come in regularly, because there's always improvements to make. And
yeah, I'll never forget that too. Starting off, it was I mean, it's safe to say it was a skeptical kind of a situation, and I think from my perspective, what was the most helpful was that I constantly was educating John every single visit, like, this is what's happening. Don't forget that this problem just didn't happen overnight. It's going to take a little bit to get it gone, but I know what the problem is, and I know what it's going to take to get it gone. And I think the timing was pretty much right on too. We just marked that, you know, this is when we want to see improvements, and as soon as that bicep tendon popped, it was a go. So.
Right. I also remember you have a lot of stretches and exercises that I do, and every once in a while I'll get lazy on one of them and forget to do it for a couple of weeks, and then I'll start to feel something, not quite right. So
yeah. Another thing about John and where he does a really good job is in his maintenance. So, you know, during times of like the CrossFit Open, or times where he knows that there's higher intensity, or he knows he's doing so much more for output, he comes in more. I mean, he takes care of it and makes sure that he's not going to be susceptible to that injury. And then if things come up, not really if, but when things come up, he gets out of them quicker as well. So,
right. Well, you know, there's that leap at the beginning. You make an investment up front. It's going to take 2 or 3 months, but after you hit that hump and have whatever watershed moment it is you have like I had, you just realize that this works, and so naturally you're going to come in and maintain it all, because what you get out of it is worth more than what you put into it.
So one thing about Finish Line here is we like to do a pretty systematic approach. A lot of times we'll start down at the ankle and mobilize the ankle, and then work our way up to the neck, and you'll see that routine. And there's a few reasons for that. One, it's predictable, especially for new patients coming in, is you know, not knowing when an adjustment's exactly going to happen, in anticipation, and it just kind of calms people. You know, John's going to know kind of the routine and what to expect and how to be on the table every time. Okay, let's flip you over, John. All right, John, let's do some of that stripping out of the shoulder here. So let's go, yep, palm up and kind of relax this a little bit. Go ahead and reach for it, and palm up. And this is just one thing that we've used for John and getting the scapular region more mobile. And head up, yep. A few more reps here and we'll switch to the other side. Okay, let me switch over here. Go ahead, yep, there. John's reaching up, going palm to the sky there. Yep, go ahead, John. Go. Really reach for it. Get the elbow up. Yep. Good. Okay, arms down. A big breath, John. Hand out. Really good. Big breath. Hand out. Good, John. Okay, let's go sideways. Big breath. Hand out. One more time. Big breath. Instead of just sit up, swing your legs around this side, and we'll do some of that shoulder stripping stuff that we've done in the past. So feet on the floor there, good. So we'll go up 90 degrees here, going from here, bent at the elbow, and John's gonna come down. He's gonna push into his stomach here. I'm just gonna strip out the bicep tendon up here. Go ahead. And squeeze, good. Again. Good, and get that elbow down with you. Yep, there we go. Good, again. Good. One more time. Good, and want your hand on your hip, just like this. Yep.
This one? Okay.
Yep, exactly. Push back as hard as you can right here. Yep, there it goes, and it clicked already. We're good. Cool. Awesome. Good job.
Excellent. Likewise.